Medical news from JAMA. Global burden of elevated LDL C, findings from the Global Burden of Disease Study 2023. Elevated low-density lipoprotein cholesterol, LDL C, remains a leading driver of premature cardiovascular death, accounting for an estimated 3.6 million fatalities worldwide in 2023, roughly 6% of all deaths, and 90.7 million disability-adjusted life years, DALYs, or 3.2% of global disease burden. Although age-standardized mortality and DALY rates have fallen dramatically since 1990, the absolute toll has risen because of population growth and aging, underscoring the urgent need for more effective primary prevention and treatment strategies. Cardiovascular disease, particularly ischemic heart disease, IHD, and ischemic stroke, continues to dominate global mortality. Yet quantifying the specific contribution of LDL C has been hampered by fragmented data on lipid levels and inconsistent risk estimates. Prior assessments relied on limited regional surveys and older risk models, leaving a knowledge gap about how LDL C-related burden has evolved across diverse socioeconomic settings. The 2023 Global Burden of Disease, GBD, comparative risk assessment was therefore commissioned to provide a comprehensive, up-to-date picture of LDL C exposure and its health impact across 204 countries and territories. The GBD team performed a population-level exposure assessment using spatiotemporal Gaussian process regression, integrating data from 806 epidemiologic studies covering 161 nations to generate mean LDL C estimates for adults aged 25 years and older. Relative risks linking LDL C to IHD and ischemic stroke were derived from meta-analyses of 38 randomized clinical trials, anchoring the reference exposure at 35 to 54 mg/dl. Population attributable fractions, PAFs, were calculated by age and sex, and then applied to cause-specific mortality and DALY counts to produce both crude and age-standardized rates, each accompanied by 95% uncertainty intervals. The analysis also decomposed temporal trends into contributions from population growth, demographic aging, changes in exposure, and risk-deleted DALYs, burden that would remain if LDL C exposure were eliminated. In 2023, elevated LDL C was linked to 3.6 million deaths, 95% UI 2.2 to 5.4 million, and 90.7 million DALYs, 95% UI 58.9 to 123.3 million. While the all-ages death and DALY counts have risen since 1990, age-standardized death rates fell by 45.6% and DALY rates by 39.5% over the same period, reflecting improvements in treatment and risk factor control in many high-income settings. Geographic disparities were stark. Eastern Europe exhibited the highest age-standardized DALY rates, whereas high-income Asia-Pacific regions recorded the lowest. Notably, India and China together shouldered roughly one-third of the global LDL C burden, highlighting the impact of large populations with rising lipid levels. Decomposition analysis revealed that demographic expansion and aging were the primary drivers of the increasing absolute burden, while reductions in LDL C exposure contributed to the observed declines in age-standardized rates. Moreover, risk-deleted DALY rates have shifted toward middle socio-demographic countries, indicating that even if LDL C were optimally managed, residual cardiovascular risk would become more concentrated in these settings. Secondary analyses showed that the burden was disproportionately higher among men and older adults, and that within regions, subnational areas with lower socioeconomic status bore a larger share of LDL C attributable outcomes. The study also identified a persistent surveillance gap. Many low- and middle-income countries lack robust, nationally representative lipid measurements, limiting the precision of exposure estimates. For clinicians, the findings reinforce the continued relevance of aggressive LDL C lowering, especially in regions undergoing rapid epidemiologic transition. The marked decline in age-standardized rates suggests that guideline-directed statin therapy and newer lipid-lowering agents are effective when deployed, yet the growing absolute numbers signal that many patients remain untreated or undertreated. Health systems should prioritize universal lipid screening, ensure equitable access to high-intensity statins and PCSK9 inhibitors, and integrate lifestyle interventions tailored to. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.